dentistry, orthodontics, restorative dentistry, and for my work in orthodontic surgery. So the TMJs are not stable, healthy, and what we do may not be very predictable, maybe unsatisfactory relative to patient balance, function, aesthetics, and particularly to pain. These are some of the most common TMJ problems that occur in the joints. And we're going to go through each one of these almost independently or individually so that you can get an idea of how to diagnose this, what kind of problems these different entities cause, and then what we know that how we can treat them with highly successful outcomes. We all know what the common TMJ symptoms are. And patients may have any, one or more of these particular factors. The important thing to understand also is that there is approximately 25% of patients who have TMJ pathology but have no symptoms until you treat them. And then sometimes their symptoms will arise as we're doing things to them, particularly in my field of doing orthodontic surgery. This is what a normal joint should look like. This is MRI, and of course we have the fossa here, the articular eminence. Here's the head of the condyle, and here's the articular disc sitting right up, in the proper position, right over top of the condyle. An opening, condyle's here, and that articular disc moves forward with the condyle, out of the fossa, just a normal function. Now here's a disc just starting to get displaced. This one doesn't make any noise yet. It doesn't click or pop. Yet it's out of place. It can cause all those symptoms we saw on the previous slides. Fossa, articular eminence. Here's the head of the condyle. And here's a posterior band, a little bit degenerated, but it's sitting right like that. As this patient starts to open, they move downwards and forwards directly on beneath the condyle, or the disc. So it reduces real early on, and it essentially makes no noises. And these are the ones that are more difficult to diagnose and often misdiagnosed. This just shows a patient with a more progressive problem. On the one side, this is this particular patient's left joint. The disc is in good position. But on the right side, look at this joint here. You'll see this patient a little bit later on. Significant degenerative changes. Here's the disc up here. Look at that disc, how short it is. Look how it gets all squinched up. Here's a normal disc over here. Look how nice and long that is. Here, it's been out of place a long time. That disc shrinks up significantly. It loses its flexibility. It becomes much more difficult to salvage. There's a lot of joints. We have disc displacement problems, but the joints are silent. They don't make any noise. And there's obviously a number of reasons for that. First, just like that case, that MRI we just showed, the disc may be anteriorly displaced, and as the condyle comes forward, that disc remains anteriorly displaced. It doesn't ever go back in place. It's a silent joint. The other one, another one is where the condyle and the disc is anteriorly displaced, but it's sitting in a juxtaproximation to the condyle, so the condyle starts to slide forward, and it does make a click or pop. But then when the patient bites together, it compresses the bilaminar tissue, which has nerves, blood vessels, and things like that in it. We see this more commonly in patients who have a real more steep articular eminence than normal. Another one is, if we look at the patient from the coronal view, from the front, this is the lateral aspect of the joint, the medial side. And the disc can slip over towards the inside of the joint, like as you see here. And then it leaves the lateral rim and the lateral pole condyle to function against each other, cause some impingement on the tissues there, and that can cause some significant pain and discomfort as well. And we have this situation over here in this joint where in some pathologies the bilaminar tissue will thicken, or this is what we might see in people who are placed on long-term class 2 mechanics, orthodontics, to try to correct the deficient mandible. Holding the mandible forward for an extended time period can cause hypertrophy of the bilaminar tissue. When this tissue gets to a certain thickness in here, you'll have a smooth translation onto the disc, and the disc, and as you open, then the disc may not make any noise. You see this also perhaps in patients who are put in, quote, TMJ recapturing splints.